Well, good morning, everyone. We're excited there was so much interest in this webinar, and thank you for attending our webinar on demystifying upstream prevention. We hope you gain valuable knowledge and some tools that will help you move to upstream approaches to addressing public health problems in the future. First, I want to start by introducing ourselves. And as Brittany said, I am Brenda Simmons, the CEO of the Institute for Public Strategies. I'm based in San Diego. We're a nonprofit organization that's been around for over 30 years doing upstream prevention of public health and safety problems. And I've been with the organization for over 20 years. Our corporate headquarters are in San Diego, and we have a lot of work that we do in Southern California, but we have worked throughout the United States implementing programs to protect health and provide training and technical support to funders and other organizations working to improve health at the community level. And I'll pass it along to Sarah now, our next presenter.
Thank you, Brenda, and hi, everyone. It's really nice to be here. My name is Sarah Blanch. I am Vice President of Organizational Development at the Institute for Public Strategies, and I have been at IPS since 2012. I'm based in our LA County offices, so I've been really involved in all of our upstream prevention projects throughout LA County. We're funded in a number of contracts by the LA County Department of Public Health to reduce substance misuse and exposure to secondhand smoke in multi-unit housing and in outdoor areas. And I also play a role managing our national training and technical assistance programs and in developing our partnerships, which are so important to us. And I'm looking forward to the discussion today, and I will pass it to Eric.
Eric, you are muted, just so you know.
There we go. Sorry about that. It's a great start. Hi, I'm Eric Collins. I'm Vice President of Programs at the Institute for Public Strategies. I started at IPS in 2009. In my role as Director of Programs, the goal is to make sure that we unsilo our projects in the best way possible to make sure that all our different projects work together. And one of the things that I'm most proud of at working at IPS is that in our 30-year history, we have implemented more than 100 upstream prevention projects across the country. Just wanted to highlight that. Now I'll send it back to you, Brenda.
Great, thank you. And like I said before, today we are going to explore what it means to prevent health problems by going upstream. And so our agenda is to first define upstream and discuss why it's important to move upstream when we're doing prevention, a practical framework for taking action, and then we'll talk about root causes and how to identify upstream solutions. So let's get started. If you're attending this webinar, it's likely that you have an interest in making people healthier, and not just yourself or your family, but lots of people, maybe an entire neighborhood or people living in a certain city or zip code. And you may be focused on a particular kind of health. Maybe your focus is on making people healthier by preventing health problems like obesity or depression. Today, we're going to explore what it means to prevent health problems by going upstream. And that is a term, upstream, that is thrown around a lot in public health circles. But when you ask someone to tell you what it means, you don't always get a clear answer, or it seems abstract. So we want to take it down to a tangible level. And the definition we're using for upstream prevention is an approach that targets the root causes or underlying factors that create public health problems, rather than just addressing the immediate symptoms or consequences. Basically, we want to get to preventing problems by tackling them as close to the root as possible. Next slide. And so let's do an exercise. Please scan the QR code on your screen. and tell us what you think the root cause of obesity might be. We'll give this a minute to populate, and then we'll talk about it. Okay, we've got a lot of root causes up there, and they look all correct to me as root causes. So there are a lot of root causes to obesity. So when we talk about getting down to root causes, it's not as simple as finding a single root cause that's going to solve a problem, but it's looking at root causes, figuring out which ones are most significant and which ones you can impact. And so we'll move into talking more about that in a minute. But right now, you were just watching what we call a word cloud, which is a great way to display qualitative data from like focus groups or listening sessions or key stakeholder interviews. It will illustrate what the themes were that came out of the discussion, and the larger words were the ones that showed up more often. The smaller words showed up less often, but all of the words are showing up multiple times. So it gives you a great way to display data for presentations to policymakers or community groups or anything like that. But let's get back to upstream prevention. So we've gone through the definition. Let's now talk about where upstream comes from and why move upstream. So upstream, the term, comes from a parable that has evolved into various versions over the years. And here's my version. Two people are fishing the riverbank below a beautiful waterfall when they see a child struggling in the current. They rescue her. Soon they see a man struggling and they rescue him too. This continues all afternoon with people coming down the waterfall and struggling in the water to survive. They decide this is a very dangerous part of the river, and so they go out and they buy a bunch of life preservers. They get their friends to volunteer to help them, and they go the next day and they save the people that come down the waterfall. They do this for several days. And finally, one of the exhausted volunteers convinces the group to walk upstream to find out where and why so many people were falling in the river. They discovered a beautiful, slow-moving part of the river where people were actually jumping off a giant rock into the river. However, some of them were unknowingly getting swept up into the current that led to the waterfall that they had no idea was there. So the group quickly went to community leaders to report the number of victims they had rescued and explain the connection to the unprotected area before the waterfall in the river. And the community leaders agreed to install a protective guard and posted warning signs. This prevented the problem, saving resources, saving energy, and saving lives, because we weren't going to get enough life preservers or enough volunteers to come every day forever to save the people that would have drowned at the bottom of the waterfall. It's always easier to focus downstream. You see immediate results. When you pull someone out of a river, you immediately know that they're okay. Their needs are immediate. It's like a person that has developed diabetes and needs insulin. Their needs are immediate and have to be addressed now. And so because it's easier to see, most of our energy is focused downstream. So it can be a real shift in thinking to move upstream, where the impact of what you do upstream may not manifest for a year, or in some cases, a decade or a generation. We can see this with tobacco. When people started smoking less, it took a couple generations before you saw those real drops in health outcomes related to tobacco. But we're never going to, as a society, go back to the high levels of smoking that we've had in the past. Upstream solutions don't just impact 1 or 2 or 10 or even 100 people either. They can impact entire populations. The tobacco campaigns and policies are one example of that. I want to give another instance, and that is that in 1994, the Center for Science and the Public Interest conducted a media advocacy campaign to get all the major movie theater chains to stop using coconut oil in their popcorn, because an average medium buttered movie theater popcorn contained more fat than a bacon and egg breakfast, a Big Mac with fries, and a steak dinner with all the trimmings combined. Can you imagine? And 1 year later, after their campaign was so effective, that in June of 1995, 5 of the 8 leading theater chains were reportedly providing somewhat to significantly healthier alternatives to their popcorn offerings. They were no longer using coconut oil. And this is just one example of how small changes can create big results. That created results across the nation. So we talked about the definition of upstream. Let's talk about the goal of upstream prevention. And it's to address the social determinants of health that present barriers to optimal well-being. And we focus primarily in underserved communities, because that is generally where the social determinants of health are most compromised. So what are the social determinants of health? Let's break this down real quick. They are the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health functioning and quality of life outcomes and risks. Basically, when we're talking about root causes, we are talking about the social determinants of health. The root causes are the social determinants of health. And Healthy People 2030 breaks the social determinants of health into 5 categories or domains: economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, social and community context. One of the most dramatic impacts tied to the social determinants of health is lifespan. This can be tracked by zip code. And the average lifespan of people living in zip codes where the quality of education is compromised, the average lifespan can be impacted. Now, in underserved communities, we often see all 5 of these domains compromised, which has a compounding effect and creates dramatic health disparities. And one thing I also want to point out here is we're talking about health and well-being, but health. And only one of these domains is really directly tied to healthcare, and that's healthcare access and quality. The other ones don't have health in them anywhere. They are not directly tied to the healthcare system. And that's because upstream factors are usually unrelated to healthcare delivery. So let's drill down on a couple of these. The neighborhood and built environment. These are things like, is the neighborhood safe? Is there enough lighting? Are there parks in the community? Is there a community garden? Are there lots of types of businesses, or are there a small number of businesses that are high risk, like liquor stores or businesses that sell cannabis? The neighborhood and built environment is critical to health on many levels. And it can be a neighborhood that creates widespread toxic stress or even community trauma if there's a lot of crime, inadequate lighting, unwalkable streets, excessive liquor stores, pawn shops, and cannabis sales. You can imagine a community like that, I'm sure. And the social and community context is about social and cultural norms. These are about having a sense of belonging in a community that is reflected by the amount of civic engagement there is, people actually engaging in the process of determining what the community looks and feels like. Are people voting? Are there active community groups, youth groups, and faith-based organizations? How about support systems and services? Do people volunteer, and what kind of policing practices do they have? Do they have police that are from the neighborhood and interact with the community in a positive way? Or is the neighborhood over-policed? Basically, in equitable community conditions create health disparities based on where the person lives or works. And these are examples of the things that can create those kind of health disparities based on the social determinants of health. I like this image because it really illustrates how the social determinants of health that often aren't considered when we're talking about health really are at the root of our ability to thrive. The ability for communities to thrive, the ability for individuals to thrive, the ability for families to thrive. And it really illustrates that. I don't want to also negate the fact that below that are things like racism, discrimination, structural barriers to health. We're not going into that today. We're sticking at the social determinants of health level. But if you went deeper in the roots, you're going to find those structural problems that are contributing to the social determinants of health and then the ability to thrive. But today we're focused on the social determinants of health and in upstream prevention, but those structural factors are just as important. And so we've covered up what upstream prevention is, why move upstream. Now we're going to talk about how to move upstream. And this is our ACT model, or our approach to community transformation. And it is a framework for upstream prevention and taking action. So now that we've talked about the what, the why, and the how, the what and the why, we're going to talk about the how. And so I am going to go ahead and pass it along to Eric to start in talking about how we get to root causes.
Thank you, Brenda. So how do we get to root causes? Well, we gather data that really helps us identify the root causes of the public health issue that we're working on. So in the next slide, we're going to go back to our approach to community transformation model, our ACT model. In many ways, some of these different elements of the model work in conjunction with each other, and sometimes they work completely alone and separate. And data and research obviously is the first part of our ACT model that we utilize to address issues in the community. In upstream prevention, we collect and analyze data to find patterns and trends to help us pinpoint those deeply ingrained systemic factors in the community that are causing problems. Now, it's important to clearly define the problem you want to address, and this will provide focus and direction to your analysis. Again, it's important to look for those reoccurring patterns, themes, commonalities, and correlations that may indicate underlying causes. In the next few slides, I'm going to provide some guidance on the tools that we utilize in upstream prevention to select relevant metrics for your work. And I'm also going to provide some data-driven insights that will help guide you in your decision-making. If you go to the next slide. All right, so first, let's quickly determine the type of data you want to start collecting in order to identify the problem that you want to solve, and then create that community transformation, that community level change. Now, for some of our folks that are newer to prevention, successful upstream prevention efforts almost always seem to have a mix of both qualitative and quantitative data assessment methods that'll help you gain a greater understanding of what's contributing to those root causes of problems in your community. Quantitative data is numbers-based, it's countable, it's measurable. Some of the quantitative tools that we use to identify community problems include surveys, such as neighborhood safety perception surveys, business safety perception surveys, environmental scans, and then we do a lot of polling, whether it's through the internet, through the telephone, or over the mail. Meanwhile, qualitative data, that is interpretation-based. It's descriptive. It's based on language instead of numbers. Now, qualitative data tools include key stakeholder interviews, focus groups, listening sessions, making observations out in the field, and then having consultations with experts in the field. And then sometimes you get a mix of both qualitative and quantitative data with tools like geographic information systems mapping, and then getting data from partners such as local hospitals, university, or even law enforcement partners. Next slide. So when doing your research and collecting data, I can't stress enough how critical it is to examine the broader systemic factors that may be contributing to the problem. So I'm glad we're talking about childhood obesity. If you're looking to lower childhood obesity rates, the systematic factors you would look at, and you guys, I love the word cloud. So awesome. I mean, I think we had probably about 50 different root causes. Some of the things that came up that I saw in the word cloud were one, economic factors. So are there grocery stores in this community, or are there food deserts where, individuals and families are only getting their food from a neighborhood market or a liquor store or fast food restaurants? What are the environmental factors in the neighborhood? Are there urban gardens? Are there farmers markets that can help fill the void? Do those farmer markets accept WIC payments to assist lower income individuals to buy fresh fruits and vegetables? What are the cultural factors? So do the farmers markets sell a wide range of produce that meets the different diet requirements of different ethnic and cultural groups? Here's another environmental factor. Do children have access to safe playgrounds and parks to exercise? Saw that coming up quite a bit in the word cloud. If not, that lack of exercise could be contributing to those higher obesity rates. Here's an institutional factor. Are there healthy school lunch programs that place a priority on nutritious food instead of junk food? And then here's another institutional factor. Do the schools in the community, do the community centers or the community profit or partners and some of the nonprofits that work in the community, do they teach health education courses that help people develop healthy diets, that help them shop for and cook nutritious foods? So when you're engaging key stakeholders, it's really important to create that authentic community level change. And doesn't it make sense to engage directly those individuals that are directly impacted by the problem, those individuals living in those food deserts with this data collection process. Now, I know a lot of you on this call, you work with community coalitions, and there's no better way to get them involved in this work, and especially in the data collection effort, is to have them go out with you and do those community surveys, do those environmental scans. And their perspectives and insights, I believe, are always going to provide that extra valuable input that you need to identify the root causes. And whether you're working on childhood obesity or another community issue, you really want to ask why and repeatedly ask why to get to the root causes of the problem. And so we will examine this a little bit more on the next slide. All right, so earlier in this presentation, I referenced global information systems mapping as an excellent tool to pinpoint root causes. And here is a middle school, and we're going to still focus on childhood obesity. Now, IPS had a contract in the city of Pomona to address childhood obesity. So we utilized this GIS mapping to see how far those fast food restaurants and how far those healthy food options are located from a middle school. In this case, it's Simon's Middle School. And we also wanted to determine how far the school is located from parks and other green spaces where children and families can exercise. So if you look on the map there, you can see that the fast food restaurants, those are the indicated with the red pins, they are located much closer to the school than the healthier food options. And those healthier food options are farmers markets, food pantries, and community gardens. They are located or marked by the green pins. Many of these parks and open spaces, those are also located farther away from the school. And so you could utilize what is called a 5 why analysis to determine what are the root causes and problem solvings when it comes to food systems inequity or any other issue. So for instance, with this particular case, you could say, well, why are there high childhood obesity rates near Simon's Middle School? Well, because the school is located in a food desert. Why is the food desert located, or why are there food deserts in this particular neighborhood? Well, sadly, it's because many grocery store chains do not want to open up stores in low-income areas that have high rates of unemployment. Okay, well then why are there high rates of unemployment? Well, because residents that live in poor communities often lack the necessary resources and opportunities than individuals that live in higher income neighborhoods. Why do folks who live in underserved communities, have a lack of resources in those communities? Well, that's because many people that live in underserved communities lack core services, including healthcare, education, and other financial resources. And so that just goes back to that tree that Brenda showed you earlier, and all those different social determinants of health that make up a community. And a healthy community addresses the social determinants in the correct way. So I think you get an idea of the 5 whys now. If you continue asking why for each next question or each answer, you kind of get to the root cause of what empowers your work with your coalition and your key stakeholders. And the rule of thumb is if you ask about 5 whys, you usually get to the root of the problem. All right, so we're going to go to the next slide. Now, I think it's really important in your work that you're not going to be able to focus on all the root causes of a problem in a community. And again, going to go back to that word cloud. We probably have 60 different examples of root causes of obesity. You can't address everything, but one thing that you can do is use a chart like the one here in front of you to rank or prioritize your root causes. Now, on the left side of the chart, you can rank vertically from low to high the frequency of the factors that contribute to childhood obesity. And on the horizontal part of the chart, you want to rank your ability from low to high on how you can impact the problem. So what happens after you fill this out is if you look at the upper top right quadrant, that is going to reveal the areas that you really want to work in, the areas that you're going to be more effective versus areas that, based on your capacity and resources, where you may not be able to make as great of an impact. And now I will pass the baton to Sarah, who's going to focus on the policy aspect in addressing root causes.
Thank you, Eric. And that was a really good primer on the various assessment tactics that we use here at IPS. And I imagine that you use them in your work as well. And we know that assessment can teach us so many things about our service communities. All communities are unique and in a range of ways. We certainly don't want to be prescriptive at all when we come into a community. And but as we've discussed today, for us at IPS, and as it comes to upstream prevention, we really want to get to the root cause of the community health problems that are most prevalent in our service communities. So why is understanding the root causes so important in upstream prevention? That is because those root causes inform the direction of our policy advocacy efforts. Once we understand the root causes of these community problems, we know which policies we want to advocate for. We have our policy roadmap. And those policies can optimize the community conditions that emerged as the most problematic or the most in need of intervention in our community systems. And as Brenda was discussing, those 5 domains of social determinants of health. And that is going to result in healthier environments and better health outcomes. That's why we call it upstream prevention. And importantly, these changes are sustainable. They are long-term and they're more cost-effective. And while direct intervention and direct service is so important as a counterpart to upstream prevention, what's the value in upstream prevention is that we are not attempting to influence the health outcomes on each individual level, individual by individual. What we're looking to do is to transform the health of an entire community so that the physical infrastructure, the built environment, the social connections, the economic opportunities, the educational opportunities are optimized so that all people within these communities have the best opportunity to attain their optimal health and their optimal well-being. Next slide. At IPS, we categorize policies in 2 ways, big P policies and little p policies. And big P policies are public policies. They are federal, state, and local laws. And then there are institutional policies that can also have dramatic impacts and in schools, in healthcare, in law enforcement. Both of these categories have great importance in creating healthier community systems. And in looking at these partial lists, you can see how we, as public health professionals who are focusing in upstream prevention, can have such an impact on the social determinants of health. On the big P policy side, the public policy, we can advocate for regulating the ability and the promotion of products that are unhealthy, or for ensuring that the parks in our communities are safe and that they're clean and that families are actually coming there. And we know that is so directly correlated to physical health and emotional and mental well-being. And we can advocate for additional green space and open areas, which is such a problem in underserved communities. We can optimize the safety and well-being of the built environment and our surroundings. And there's so much work being done around transportation, getting bicycle and walking lanes put into communities, and to have greater mobility options, safe, accessible, and affordable transit for communities. Of course, safe and affordable housing. And as Eric was discussing earlier, food. That's a big area of focus for a number of organizations, ensuring that communities have access to healthy food options. It's not just liquor stores that are within a mile's distance. They can get to some healthy food, or community gardens. In terms of institutional policies, there's so much great work that we can be doing there. Schools, we can ensure that there are additional literacy and language programs. increased behavioral health services, which is such a focus. Youth and young adult mental health and well-being is such an area of focus right now, and importantly so. And early childhood education, vocational trainings. In healthcare, ensuring that there is a consistent standard of care, particularly in underserved communities, ensuring that there's adequate linguistic and cultural competency, and also ensuring that there are an adequate number of providers and pharmacies that are available within communities. So we can see here, and this is just the beginnings of a list of really our ability to impact the social determinants of health in the communities that we're serving. Next slide. There are three types of policies, and evidence-based, evidence-formed, and promising. And evidence-based policies are just that. They are based in empirical evidence. And that means that there is a significant body of research that demonstrates that these policies are effective. They result in positive health outcomes. And then there are evidence-informed policies, and they are not as thoroughly vetted as evidence-based policies, and yet there is an emerging body of research that these policies are shown to be effective. And then there are promising or innovative strategies. And these are those that have potential, but perhaps they haven't been researched as thoroughly. Now at IPS, and I imagine you and your work, we focus a lot on evidence-based and evidence-informed policies because, again, they are supported by data. However, there's important work to be done around promising or innovative strategies. What we do in those instances is there are a number of community-based researchers, maybe at a local university, that are really needing that partnership from us to be able to bring their research into practice. So there really are opportunities to engage researchers throughout the lifespan of our projects, and we actually can be contributing to the field of science in upstream prevention. In terms of resources, there are lots, and we know that policy work can feel intimidating, but there are a number of really, really useful resources to help at every stage. And to the best of our knowledge, there is no one resource that encompasses it all. Obviously, there's so many topic areas, it's very broad, but this is just a little beginning for you, and you can be doing your own research. There are a number of policy menus that exist that literally lay out evidence-based, evidence-informed, and promising practices in various public health topic areas. Some examples: Substance Abuse and Mental Health Services Administration, Trust for America's Health, Policy Link. These are organizations that we use regularly. They literally have pages dedicated to evidence-based policies and practices that we can educate ourselves on. Another big area of help are model policy templates. There are organizations that literally have the language that you can go and you can download and you can use to support your own work, to be rolling out your policies when you're with your coalitions and you're engaging with policymakers. Some that we particularly appreciate, a lot of our work is in substance misuse prevention. Getting It Right from the Start has cannabis policy templates. Change Lab Solutions is a great one, and cityhealth.org. They all are really great resources to get the language for a sophisticated model template for the policies for which you're advocating. And also, we're going to be providing our emails at the close, and Eric is a really great resource. He can point you in certain directions if you have specific questions, and we have a number of resources that we have used over the years, and we'd be happy to share those with you. Next slide. We've talked about policy. Let's get back to our community change model. And we're not proposing that the ACT model is the only approach to community change. I'm sure there are a lot of commonalities and a lot of different frameworks that are used. This is the one that we use. And just the last area that we wanted to make sure to focus on today is so important, and that is community organizing or coalition building. And we define that as mobilizing communities to build collective power. This work is not achievable without our communities. And for us, there are three primary principles that we use and rely on. we mentioned this earlier, we definitely want to be involving those community members who are directly affected by the community problems. They're the ones who have the insight. They're the ones who are going to have the voice around these issues. We also, as we've discussed, we want to include them in every stage. We want to bring them in. There's no more valuable resource to help us understand what's happening in the neighborhoods, all the dynamics around enforcement, schooling, job opportunities, lack of safety, lack of healthy alternatives for living, and all kinds of insights that they hold for us. And then importantly, we always say it's their show. We want to let them lead. There's education that happens around the evidence-based practices that they can understand better, and about what environmental prevention or upstream prevention is, but they lead. That's necessary really to get their true authentic engagement. Next slide. A couple other things on community organizing before we get into 2 case studies that we're going to share with you is that you're going to find that there's going to be some work to do to ensure that the focus of coalitions is going to include upstream interventions and an upstream approach. As we discussed, while direct services are really important, and that they're also in some ways they're easier to accomplish, they're more immediate, they're more understood. There is some education that can be required of our community members to help them understand why upstream prevention is a really important approach to create that long-term and sustainable change in our communities. Also, as I touched on earlier, this has to be community driven. And I'm sure we've all had that experience, and we've had our own learnings with our coalitions that we can educate our coalitions and our community members, but we definitely cannot dictate to our community members. We want them to be engaged in the process from the beginning and working collaboratively to come toward our solutions. That's what creates that heart. That's what's going to get them to come up with your mission and your vision and your core values and your goals, and to come to all of the important meetings and hearings that you want them to come to. And then lastly, we all know this work is not a straight line. It's a curvy line. So it takes patience. It can be a long-term process. So we remind our coalitions of that. We have to be flexible and adapt to the changing conditions in our communities on the ground. And we want to celebrate the small wins. If we got a great article published in the local paper, if we got one of our policy advocacy policies agendized at City Council, we really want to celebrate those small wins along the way because they mean a lot too. Next slide. So here's a picture of West Hollywood, California. That's the entertainment district there. We're going to get into a couple of case studies here. The West Hollywood project is one of our LA County projects. And West Hollywood is a city. It's kind of nestled within the city of Los Angeles. And it is a very thriving, vibrant community that has a really active entertainment district. It is has a large LGBTQ plus population, and it also draws visitors, LGBTQ plus visitors from the whole county, in the state, and even across the nation. It's a real gathering place. Our work in LA County is around substance misuse. So we came into the project as we do all projects. We started with our assessment. We looked at secondary data. We conducted focus groups and key stakeholder interviews. We did telephone surveys to really get at what the picture was around substance misuse. And some of the key elements that stood out to us was that West Hollywood, of all cities in LA County, had the highest density of on-sale alcohol outlets. And those are bars and clubs primarily, and also restaurants. And that there was a lot of nuisance activity happening outside these clubs and bars. They're very adjacent to neighborhoods, and there was a lot of community concern about that. There was also concern about over-serving practices, and not enough bars weren't being vigilant enough about that. And then just generally, I think a complacent attitude about enforcement. When I say enforcement, I mean of the business practices. The bars and clubs play an important role in the economy, and rightly so. It's an important thing, but that led to a complacency around ensuring that those business practices were up to standards to make sure our communities were health and safety. So what we got to from that is that alcohol was the primary substance of concern and had the biggest impact in West Hollywood, and that its root cause, which we would not have known without our assessment, was really that inadequate enforcement of business practices within those entertainment districts. The coalition that we worked with, and it was a 2-year process, was our Safe West Hollywood Leadership Council. We did that education that we talked to them that we talked about earlier. We literally laid out a menu of evidence-based practices that are focused on retail alcohol environments. We educated them about upstream prevention and about advocacy and their role. And we collectively arrived at an institutional policy, and that was to add an alcohol liaison officer to the West Hollywood Sheriff's Department. And that person's job would literally be to proactively engage with problem establishments and to bring them into compliance, and just to generally create a better culture, a more responsible culture around business practices. We were successful with that. We represented it at City Council. It was unanimously voted yes. So they did add an alcohol liaison officer. And over a 2-year period, we saw some pretty dramatic data. DUI arrests were down 37% in West Hollywood. Drunk in public arrests were down 40%. And Part 1 crimes were down 6%. And that is according to West Hollywood Public Safety reports. So we can see that this is a picture of a really great example of upstream prevention. And we're going to go to one last case study. And that is Casa de Oro. Here's Casa de Oro pictured here. And Casa de Oro is a city in San Diego County. And again, our charter was to reduce substance use problems. And we were hearing again from our initial key stakeholder interviews that there was a real concern around the Campo Road corridor. And that was a business district that was really primarily had sort of nuisance businesses, pawn shops, liquor stores, and the general character of the community was there was a lot of garbage and detritus, there was crime, families weren't going there. And that our area of focus became this Campo Road corridor, which came up as a theme in our assessment efforts. And our youth-led assessment revealed to us that in that area, 100% of the liquor stores were out of compliance. There were 19 liquor stores in that area where Department of Alcoholic Beverage Control, their limit was 3. So it was very overconcentrated. There were 6 schools that were in close proximity to this area and that were being impacted by this culture of lack of safety. And also that there was just a really dramatic different character than their adjacent city, La Jolla. And so that was really a motivating force in jumpstarting our coalition. So really, we came to understand that the root cause of these alcohol-related problems were the zoning laws within the Campo Road district. And the zoning laws were old. They really discouraged healthier businesses from coming in. And that became our focus. So the Casa de Oro Alliance is really one of our best coalition success stories. We've had over 200 community members involved. They lead, they have their own structure. They have been engaged doing cleanups. But in terms of the policy aspect, they arrived at presenting a new area specific plan to the Board of Supervisors. So again, this isn't overnight work, but after meeting with the Board of Supervisors representing the plan, we're very happy to report that in January of this year, this new area specific plan was passed unanimously by the Board of Supervisors. And it includes new zoning laws that really make it easier and more attractive for new businesses to come in and operate. Whereas before they just said, no, there were too many boundaries and hurdles to entry into that area. It provides better public transit, better access, wider sidewalks, and just better traffic management. And the whole goal is to create this as a destination that is going to really change the character of that community and really reduce those alcohol-related problems that were stemming from this area. And we have one more slide. These are just some pictures. here's some pictures of the Casa de Oro Alliance at work, doing their meetings. Picture in the lower right is of them at a community cleanup, organizing to go talk to the Board of Supervisors. So there's just some real pictures of that community at work. And with that, I will turn it back to Brittany.
Thank you so much, Sarah. And I just want to give a huge thank you to our presenters, Brenda, Eric, and Sarah, for really helping to break down upstream prevention and providing some case studies, which are always helpful, and examples and tools that hopefully folks can take to really look at moving upstream and how they can implement those approaches in the work that they're doing. So I do want to share their contact information if you want to grab it. I'll also go ahead and drop it in the chat in just a few minutes. And just a quick reminder, we did record today's webinar, so the recording and also the slides will be sent out later today. If you do need a certificate of attendance, you can email me, and I shared my email in the chat, and I'll share it again, and I will get those out to you by the end of next week. And just moving into our next slide before we get into Q&A, we do value your guys' feedback. So there is a QR code. You will also be prompted at the close of the webinar. It'll bring up a browser page for you to actually click a link to take our evaluation. This will really help inform us moving forward in our webinar series, excuse me. Yeah, so if you guys can, we really appreciate it. I also want to share, as Sarah mentioned, that we do provide training and technical assistance. And if you're interested in learning more, feel free to reach out to myself or our info@publicstrategies.org email. So I'm going to go ahead and bring up our Q&A. And one of the first questions we have, and Eric, I'm going to pose this to you. In qualitative data collection, should we limit the process to people only affected by the problem? A lot of times people who don't live in the targeted problematic area get their input into that collection, but it doesn't really reflect the reality of the community suffering the inequalities and systematic racism that exists.
So Juan hit it on the nail. And it really goes back to that community organizing slide that Sarah showed us earlier, and that you really have to work with the individuals affected by the problem. So in reference to what Juan is stating here is, should we limit the process to people only affected by the problem? I would say yes. First and foremost, collect the data and do those surveys and do those key stakeholder interviews with people that do live in the targeted problematic area, because that is where you will get the greater picture of the inequalities and the systemic racism that is happening in that community. Absolutely, Juan.
Thank you, Eric. And our next question talks about evaluating and looking at metrics. And so I'm not sure if I should pose this to Eric or Sarah. I know you guys have both been working a lot on this within IPS. So I'll let you guys kind of decide who answers it. But how can we effectively evaluate incremental progress metrics within a proposed initiative, conducting a cost-benefit analysis and advocating for long-term sustainability?
I think we could tag team this all together. One of the first things that I'll say, it is challenging with a lot of projects, and that you don't have project evaluators, but that's why most projects have logic models. So you can look at short-term, medium, and then long-term, 5-year, first year, third year, fifth year, and look at your different metrics and see how those align with your logic model to see if you're making progress. As far as long-term sustainability, I think in terms of data collection and research, once you pass, whether it's a big P or a small p policy, sometimes you go right back to the start and you collect that same data, 5 years in after you got a policy that you collected right when you were at the very beginning of a project, because you want to see, have you made a change in the community? Is the policy doing what it was written, what was intended to do? So I think data collection is critical throughout the entire process. As far as cost benefit analysis, I don't know, Brenda, if you want to touch on that, or Sarah, a little bit.
Go ahead, Brenda, on that. And I had a couple thoughts about the community-based research opportunities. I'll go after you.
Okay. Well, the sustainability comes in really the focus on policy and public policy and institutional change, because when you put those things into place, they generally are, they generally last. And so over time, they really create changes in behavior. And you can see that with seatbelt laws and tobacco historically, all kinds of other things where once it's put and institutionalized or put into codified in laws and public policy, that's where the sustainability comes from. There's another form of sustainability, though, that's really important, and that is the sustainability of the community group that is working on the problems. And so if you have a community group, you don't want to be in charge long term. You don't want to be providing the leadership. You want to be providing the technical support and get them to a point where they can function on their own and deal with a myriad of problems in their communities, not just the ones you've helped them with, but they've got the skills and tools. And that is, I think, one of the most important forms of sustainability that you can have.
Yes,
Thank
I
you.
was just going to add that, yes, sustainability is so important, and sustainability is a factor in the programs from the beginning. And in terms of assessment, I realize that we're really lucky in LA County. We actually have 5% of our budgets are allocated to evaluation of it with a third party, and that is incredibly unique. So that's not typically the case. So I think there are a couple things I wanted to say. One of them is that there are a number of community-based researchers, as I referenced earlier, that don't have avenues to getting their programs and their research evaluated. Those partnerships can be found. And we're actually in the process of developing a researcher council that is going to be comprised of some community-based researchers to help answer some of these questions and provide resources around exactly these questions. How to have a more systematic approach to evaluation across all public health topic areas. We're in the process of developing that. There are also other options that you can do within your programs. You want to understand the conditions before, and then you want to understand the conditions after, the same metrics, and measure those and then benchmark it over time. We have community perception surveys that we implement in the field with community members who come by, and we reference secondary data at the beginning and the close of the programs. Those really do help provide that picture.
Thank you, Sarah. Speaking to Casa de Oro initiative a little bit, and Brenda, I'll pose this to you because I know you were very much involved along the long road that it was. Did the Alliance do a review on why the city policies and laws were not being enforced?
Absolutely. And that was a root cause of problems, that the city policies and laws weren't being enforced. It actually isn't a city, it's an unincorporated area in the county, or an unincorporated community. And our unincorporated area in San Diego is very large, and there's limited resources, and frankly, the squeaky wheel gets the attention. And so the fact that Casa de Oro had become this kind of forgotten community or ignored community, and no one was bringing it to the attention of police and the supervisors and the key leaders. People had just kind of given up on it. And as soon as they started kind of shaking the trees about Casa de Oro and saying the community was saying, we want to see change, they were able to get the attention of the sheriff's department, of code enforcement, of the county board of supervisors. And that's when the project really took off. But it took that, that joined forces of community members to make that happen. And then the laws and policies were getting enforced better, but some of them were just not a good fit. The land use policies were not a good fit for Casa de Oro. They actually limited business interest in the area, and so you just had the interest of challenging businesses that tended to be high risk that were coming in because of low rent. And so, but yes, absolutely, that was definitely a root cause and a part of what we looked at.
Thank you, Brenda. I do want to be mindful of time. It is 11:01, and I know we didn't get to all the questions, but I just want to give a huge thank you to our presenters, Brenda, Eric, and Sarah, for leading us today and sharing the knowledge that you guys have. And really thank you to all of our participants who logged in and joined us today. We really appreciate you being here. If you have any questions, feel free to reach out to me. You can email me at bhunsinger@publicstrategies.org or the info@publicstrategies.org, and we'll be sure to answer any questions that you have or provide you with any additional information that you might need. So thank you, and I hope you have a great rest of your day and a wonderful rest of your week.